friends. So the topic for today's discussion is brachial plexus. In this part of session, we will learn what is brachial plexus, how does it forms, what is the clinical relevance of the topic, that is brachial plexus. So brachial plexus, in fact, brachial plexus is basically it is basically a network of nerves that supplies the upper limb. So we have a lot of nerves that supply the different part of the upper limb, like the muscle, the joint, and the vessels. So there are various nerves that supplies the upper limb. They form a network plexus, which we call as a brachial plexus. Before going into details of the brachial plexus, we have to emphasize on the spinal cord and how the spinal nerves are formed. How the spinal nerves are formed. So these are basic before knowing the brachial plexus. So we all know that we have a long cord inside our vertebral column. Inside our vertebral column, we have a long spinal cord, and it gives 31 pairs of spinal nerves. 31 pairs of spinal nerves. So from the region of the cervical to the coccyx, we have C8, total 8 pairs of cervical spinal nerves. Then we have thoracic, 12 pairs of thoracic spinal nerve. Then we have lumbar, sacral, and 1 pair of coccygeal spinal nerves. So we have 1 pair of coccygeal spinal nerve. So in the region of cervical, the cervical spinal nerves, the lower cervical spinal nerve along with the T1 spinal nerves, they form a network of plexus which is known as brachial plexus, which is basically responsible for the nerve supply of the upper limb. So if we look in the cross section of the spinal cord, so this is the cross section of the spinal cord. We will see here, this is the lighter area which is known as white matter. Then we have the darker area which is known as gray matter. So this is your white matter and this is your gray matter. In a spinal cord, the gray matter are arranged in a projected form. There are certain projections which is known as horn. So on the ventral side, we have the ventral horn. This is the ventral horn of spinal cord, and this is the dorsal horn of the spinal cord. Dorsal horn of the spinal cord. In some part of the spinal cord, you will also find the lateral horns. So we will also find the lateral horns of the spinal cord. So so in this spinal cord, the ventral horn gives some fibers, nerve fiber. This form the ventral root. This is the ventral root. And the dorsal horn gives some nerve fiber which forms the dorsal root. So the dorsal root of spinal cord and the ventral root of spinal cord. The dorsal root comprises of sensory fiber which carries in sensory information, and the ventral root comprises of motor nerve fiber which carries the motor information. Together, the dorsal root and ventral root, they together combine and form a spinal nerve. So this is a spinal nerve. So this spinal nerve, after coming from the intervertebral foramina, it divides into two parts. One is your dorsal ramus and the one is your ventral ramus. So one is your dorsal ramus, which is responsible for the nerve supply of the back, and one is your ventral region, ventral ramus, that is responsible for the supply of the ventral part of the trunk. So this ventral part, the ventral ramus of the C5, C6, C7, C8 and T1. These ventral ramus of these 5 spinal nerve, they form mainly a network of plexus that supplies the upper limb, which is known as brachial plexus. So this is known as brachial plexus. So now we will see what are the components of the brachial plexus. Brachial plexus comprise of some roots, then roots unite, they form the trunk, then trunk divide, they form the division, and finally cords and the branches. Suppose these are the roots of the these are the roots of the brachial plexus. So we have the ventral primary rami of the C5, we have the ventral primary ramus of the C6, then C7, C8 and T1. The upper two roots, these are the roots of brachial plexus. The upper two roots, they unite and form the upper trunk. This is trunk. So the second component of the brachial plexus is trunk. The C7 root, it continues as a middle trunk, and together C8 and T1, they unite and form the lower trunk. So brachial plexus is having three trunks. One is your upper trunk formed by the ventral primary ramus of C5, C6. The middle trunk, that is the continuation of the C7 ventral primary ramus, and the lower trunk, that is formed by the union of the roots of the C8 and T1 of the brachial plexus. These trunk again they divide into anterior and posterior division. So the middle trunk again divide into the anterior and the posterior division. Then we have the lower trunk divides into anterior and the posterior division. Now, the posterior division of all the trunks, whether it is C5 upper trunk, whether it is of the middle trunk, and whether it is of the lower trunk, they unite and form the posterior cord. Now, the next component of the brachial plexus is cord. We have seen the root, we have seen the trunk, we have seen the divisions, and now this is the cord. So, the posterior division of upper trunk, middle trunk and the lower trunk, they combinedly form a cord which is known as posterior cord. The anterior division of the upper trunk and the middle trunk, they unite and they form lateral cord. Lateral cord. And one is rest. So this one is the anterior division of the lower trunk. It continues as a medial cord. So we have finally three cords. One is your lateral cord, one is your medial cord, and the one is your posterior cord. So these cords are named according to the second part of axillary artery. So these cords, the name of these cords, what we have called as the posterior cord and the lateral cord and the medial cord. These names are in relation to the second part of axillary artery. If the cord is lying posterior to the axillary artery, it is known as posterior cord. If the cord is lying lateral to the second part of axillary artery, it is known as lateral cord. If the cord is lying medial to the second part of axillary artery, it is known as medial cord. So we have finally three cords. So in this diagram, you can see the primary ramus of the C5, C6, they form the upper trunk. The the roots of the C7, it continues as a medial trunk. Then the roots of the C8 and the T1, they unite and they form the lower trunk. So here you are seeing the upper trunk, the middle trunk and the lower trunk. Basically, the brachial plexus is divided into two parts. One part lies above the clavicle, that is known as supraclavicular part, and the part lying below the clavicle is known as infraclavicular part. So in case of supraclavicular part, we are seeing the roots of the brachial plexus, the trunk of the brachial plexus, the division of the brachial plexus. Rest of the part, the cords and the branches of the brachial plexus, they are infraclavicular part of the brachial plexus. So I have told you the name of the cords is on the basis of their relation to the second part of axillary artery, to the second part of axillary artery. So in this diagram, you are seeing this is basically the pectoralis minor muscle that is originating from the third, fourth and the fifth rib, and it is giving and it is inserting on the coracoid process. So this pectoralis minor muscle divides the axillary artery into three parts. The part lying proximal to the pectoralis minor muscle is the first part of axillary artery. The part lying behind the pectoralis minor is the second part of axillary artery, and the part distal to the pectoralis minor muscle is the third part of axillary artery. So these cords are named according to their relation to the second part of axillary artery, which is lying behind the pectoralis minor muscle. So I have told you how these cords are formed. So again, I want to just emphasize how the roots are formed. So we have the ventral primary rami of the C5, C6, C7, C8 and T1. These ventral primary tremors, they form the roots of the brachial plexus. The upper two roots, they unite and form the trunk of the brachial plexus. And the middle, this C7, the root of the C7 continues as the middle trunk. This is your middle trunk, middle trunk, middle trunk. This is your upper trunk. Then C8 and T1, these root unite and they form the lower trunk. The upper trunk, it divides into anterior and posterior division. Again, the middle trunk divides into anterior and posterior division. The lower trunk also divides into anterior and posterior division. Now we join all the posterior division and we form a cord that is known as posterior cord. And the anterior division of the upper two trunk, they form the lateral cord. Now the anterior division of the lower trunk continues as a medial cord. We will see the branches of these cord in details. So often you are asked in your PT entrance exam, what are the branches of the lateral cord, what are the branches of the medial cord, and also what are the branches of the posterior cord. So first of all, the branches of the lateral cord. So lateral cord, you can memorize it by LML. So the lateral cord is having three branches. One is for the lateral pectoral nerve that supplies the pectoralis major and pectoralis minor muscle. Then you have the musculocutaneous nerve that supplies the muscles of the front of the arm, muscles of front of arm. Then you have the lateral root of median nerve. You have an important nerve in your upper limb, that is median nerve. It is comprised of two parts. One is your lateral root and the one we will see in next few minutes, that is your medial root. So the lateral root of median nerve is also a branch of the lateral cord. So lateral pectoral nerve supplies the pectoralis major and minor muscle. The musculocutaneous nerve supplies the coracobrachialis, the brachioradialis, and the brachialis muscle. They are the muscles of the anterior of the arm. Then you have the lateral root of median that unites with the medial root of median and finally forms a main nerve of your forearm, that is your median nerve. Then we have the one important question which you are asked in your PT entrance exam. You have to remember all the nerve roots value of these branches. So in general, the lateral cord, because it is formed by the upper division and the middle trunk. So the root value, of all the nerves of lateral cord are same. They are C5, C6 and C7. Whether it is lateral pectoral nerve, whether it is lateral root of median, or it is musculocutaneous nerve, the root value of all the three nerves are same, that is root value C5, C6, C7. So you have to remember the root value of the lateral cord is C5, C6, C7. So all the nerves arising from the lateral cord, they share the same root value, that is C5, C6 and C7. Now coming on to the branches of the medial cord. So coming on to the branches of the medial cord. In medial cord we have branches like 4M and 1U. The 4M stands for medial root of median. We have already discussed the lateral root of median. Then we have the medial cutaneous nerve of arm. Then we have the medial cutaneous nerve of forearm. Another M is for the medial pectoral nerve. The U stands for the ulnar nerve. So U stands for the ulnar nerve. And the root value of all the nerves arising from the medial cord is C8 and T1, except when you talk about the ulnar nerve, you add C7 also. So the root value of ulnar nerve is C7, C8, T1. Otherwise, all the 4M The root value is same, that is C8 and T1. So whenever MCQ is asked on what is the root value of medial root of median, what is the root value of medial cutaneous nerve of arm, forearm, you have to answer C8 T1. In case of ulnar nerve, the C7 also participate as a nerve root of the ulnar nerve. Now coming on to the branches of the posterior cord, we have 5 branches in the posterior cord and they can be memorized by the mnemonic. So coming on to the posterior cord, so the branches of the posterior cord, there are 5 branches and you can memorize it by the ULTRA. U is for the upper subscapular. L is for the lower subscapular. T is for the thoracodorsal or nerve to latissimus dorsi. R is for the radial nerve and A is for the axillary nerve. So the mnemonic for the branches of the posterior cord is ultra, U for the upper subscapular and L for the lower subscapular, thoracodorsal, radial and axillary nerve. Thoracodorsal or the nerve to latissimus dorsi supplying to the latissimus dorsi muscle. Radial nerve is the main nerve of the posterior compartment of the upper limb. Axillary nerve supplies deltoid muscle and teres minor muscle. And the root value of all these are in general C5 and C6. In case of radial nerve, in case of radial nerve, you can add C5, C6, C7, C8 and T1. So all the roots are involving in the formation of the radial nerve. So these are the branches of the cords like lateral cord, medial cord and the posterior cord. So in this diagram you are seeing this is the muscle, this is the cut section of the muscle, that is pectoralis major, this is pectoralis minor. Here you can see nerves, this is the lateral pectoral and the medial pectoral nerve. And this is basically axillary artery, the red color around which you are seeing the yellow branches of the cords. This is basically the axillary artery. So we have the lateral cord, the medial cord and posterior cord according to the second part of axillary artery. This muscle is latissimus dorsi. Here you can see this is latissimus dorsi. This is your teres major muscle. So these muscles are supplied by the branches of the cords of the brachial plexus. In the same diagram, you are seeing these are the C5, C6, C7, C8 and T1. These are the roots and the roots unite, they form the upper trunk. One important MCQ what you have been asked in your exam is the roots of the brachial plexus comes out through which of the following muscle. So the gap between two muscle, that is your scalenus medius and scalenus anterior, there is a gap between the two. These are the two neck muscle. One is known as scalenus anterior and the one is known as scalenus medius. So there is a gap between these two muscle. So between these two muscle there comes out the roots of the brachial plexus, then they form the trunk, then they form the division and finally they form the cords and the branches. So it is the same diagram where you can see the branches, how the upper trunk form, middle trunk form and the lower trunk form. This is your clavicle, so behind the clavicle the divisions are formed. Now downward infraclavicular part you can find the cords and the branches of the brachial plexus. Now what is the clinical significance of studying the brachial plexus? Why we are studying brachial plexus? So there are two important nerve injury. One is of the upper trunk. So upper trunk, if there is nerve injury of the upper trunk, this is known as Erb's palsy. So the sign and symptom arises according to the nerve damage. So which muscle is not working, accordingly the sign and symptom of that particular nerve is appearing. But in case of Erb's palsy, if the upper trunk is injured, you will find there is involvement of the C6 root, paralysis of the deltoid muscle and the paralysis of supraspinatus, infraspinatus and teres minor muscle, and also the paralysis of the biceps brachii. So let us understand how these muscles get involved in the Erb's palsy. I have told you the upper trunk is formed by The the two roots, the C5 and C6, they unite and form the upper trunk. At this point, the upper trunk, you will find two another branch. One is nerve to subclavius, another one is your suprascapular nerve. So, and then again this upper trunk divides into the anterior division and the posterior division. So this point where you can find six nerve, two from the roots, two for the division and one for the subclavius and the suprascapular nerve. This point where six nerve meet is known as Urb's point. Urb's point. So these muscles get involved at the in the Ars palsy. So there is involvement of the C6 root. So you will find the patient will present to you with a loss of sensation over the lower part of the deltoid muscle. Then you have the muscle paralysis of the deltoid, because deltoid, the main function of deltoid is abduction of the shoulder. So you will find there will be adducted arm, because abduction is not possible, so the arm will be adducted. And because of the paralysis of the supraspinatus, infraspinatus, teres minor muscle, you will find there is medial rotation of the arm, because infraspinatus and teres minor, they combinedly form the, they are basically the lateral rotator of the arm. So if the function of these muscles are lost, you will find that the arm is hanging by the side and they are medially rotated. Then you have paralysis of the biceps brachii, because the upper trunk has gone, so there will be a loss of function of musculocutaneous nerve also. So you will find there is paralysis of biceps brachii, because musculocutaneous nerve supplies biceps brachii also. So biceps brachii is paralyzed and you will find the arm is at forearm is extended and pronated. So these are clinical feature and their basis. How does this happen in the case of a palsy? So this is the summary of a palsy. So basically the nerve in root injured is C5, C6, and the site of injury is the upper trunk, where you can find there are six nerves are meeting, C5, C6, along with anterior and posterior division of the upper trunk. Then you have, there is a suprascapular nerve and the nerve to subclavius. They all together forms the Erb's point. And what is the cause or the etiology of the Erb palsy? Sometime during the obstructed labor, the baby is pulled forcefully, so there becomes angulation. The angulation is more between the head and the neck, and that leads to the injury of the upper trunk in case of neonate or the baby, and that leads to the palsy. Or a person, adult person, is falling on his shoulder, that can lead to stretching between the head and the neck region, and that can cause injury to the upper trunk, and that can lead to the Erb's palsy. What deformity happens in Erb's palsy? You can find paralysis of deltoid, so the arms will be adducted, paralysis of supraspinatus and infraspinatus and teres minor, that can lead to medial rotation of the arm, paralysis of biceps and brachii, that biceps brachii is lost, so there is extension and pronation of the forearm. And because the C6 root is also injured, you will find there is loss of sensation along the outer aspect of the arm. Next is your Klumpke paralysis. Klumpke paralysis is basically the injury of the lower trunk. So these questions are often asked in your exam. The injury of the lower trunk is known as Klumpke paralysis. The injury of the upper trunk is known as Erb's palsy. So in case of Klumpke paralysis, you will find the site of injury is the lower trunk of brachial plexus. The nerve root value is C8 T1 root, because you know the lower trunk is formed by the ventral primary ramus of C8 and T1. So this is lower trunk which get injured in the Klumpke paralysis. How does it happen? Pulling of arm away from the trunk, pulling of hand during childbirth. In case of obstructed labor, sometimes there is shoulder dystocia and we pull the baby forcefully through his hand. So this can lead to the injury to the lower trunk, and it can lead to the Klumpke paralysis. What are the causes of the Klumpke paralysis? You will find there is paralysis of the intrinsic muscle of the hand that can lead to the claw hand. Then you have the injury of the T1 fibers that can lead to loss of sensation along the medial border of the forearm and hand. and then some sympathetic fibers of the thoracic one spinal segment are also lost or injured, and this can lead to ptosis, that is drooping of the upper eyelid, drooping of upper eyelid. This is known as ptosis. Then meiosis, you will find constricted pupil, then anhidrosis, there is loss of sweating. Anhidrosis, and matlab without, anhidrosis means water, so there is loss of sweating over the neck. Then you will find anophthalmos, that is sunken eyes. So these are some clinical features you will find in your clumsy paralysis, and these are very important applied aspect of the brachial plexus. So this is all about the brachial plexus. So what you have to remember, the root value, how does it forms, and what is the clinical application of the brachial plexus. All these are very important for your PGM exam as well as professional exams. Thank you so much.